Hi, my name is Maria. I am the office manager at Naperville Family Dental Care. I have a few questions for Dr. Adel that many of our patients have asked us. The first question is, what is the difference between regular cleaning and deep cleaning?
It's a very good question. By the way, hi, my name is Dr. Adel. I'm the dentist at Naperville Family Dental Care. I've been practicing in Naperville since August of 2000, providing care for families and patients in the Naperville area, Aurora and the surrounding areas. It's a wonderful question you asked, Maria, and I think it's a lot of patients ask that question. What is the difference between a regular cleaning and a deep cleaning? There's a big difference between the two. And before I explain the difference, I have to actually say the reason why the different kinds of cleanings have to be done. The simple difference is that a regular quote-unquote preventive cleaning is done to prevent disease. So it's done in absence of disease. Usually patients come in every 6 months, and as long as there's no disease present, and by disease we mean gum and bone disease, which I will explain in a little bit. When they come in every 6 months and there's no disease present, we do a preventive cleaning to prevent problems from happening. Best example of that would be for example, if you take your car in for every 3 months to have the oil changed. It's the same concept. I know it's a crude example, but that's a good way to think about having a preventive cleaning done, having a preventive oil change done every 3 months. The car doesn't have any problems, you're just changing the oil. A deep cleaning, on the other hand, is done when there is disease present, when there is gum and bone disease present. And in a simple form to explain that is that our teeth are embedded in our jawbone, and that's the only thing that holds our teeth in our head. And the teeth are actually covered with the gum tissue is almost like a very tight curtain that's hugging the teeth very tightly. Bacteria and germs live in and around our teeth all the time, and the food that we eat obviously is also there too. We eat several times a day, and those bacteria feed off of the food particles and food that we eat and we drink, and as they consume that food, they produce waste products, and those waste products, or the most important waste product, is acid, which is eating away at the gum tissues, and it's peeling away that tight curtain of gum tissues, and it can go in between the teeth and go deep down below the surface, and hence the word deep cleaning. Once they go deep down, they can cause the gums to peel away, and the way we check that is we use our little ruler and we measure the depth of those pockets that are created, or those deep areas that are created. So for us to be able to clean those deep pockets where a patient cannot clean with a preventive cleaning that's done every 6 months, we do a deep cleaning, and that's usually done to prevent further problems, the disease from eating away from the bone and causing the teeth to get loose, bleeding in the gum tissues, odor in the mouth. Those are the things that we usually look for a patient in a patient if there is disease present. So that's a very quick way to explain deep cleaning versus a preventive, regular, quote-unquote cleaning.
Now, doctor, is it painful to have a deep cleaning done?
Very valid question. Generally, no. When we do a deep cleaning, we do everything in our power as practitioners to keep the patients very comfortable. One of the things that we do is we use topical gel materials, topical anesthetic gel materials to pre-numb the areas where the deep cleaning is to be done. And then we do anesthetize, administer anesthesia, and we try to make it very comfortable. So during the process, when the deep cleaning is being done, it's fairly painless. There is no discomfort. Afterwards, yeah, there will be usually some discomfort. Usually we cover patients with either the over-the-counter pain medications or prescription pain medications, and we give them guidelines to follow so then they can decrease the sensitivity and pain afterwards. But there is some discomfort afterwards, but hopefully not during the process.
Now, Dr. Doe, what happens after deep cleaning is done?
After deep cleaning, we're talking about the gums being peeled away because of the disease. After we clean and remove those germ particles and the disease below the gum line, deep below the gum tissues have an easier chance of reattaching or coming back together and tightening up around the teeth. During that process, food particles and bacteria can also get back into those pockets, so it's extremely important that patients on on their own follow up and they follow the regimens that we recommend, the important regimens that we go through, including flossing, using oral mouthwashes, certain guidelines that we give patients, a handout that we give patients that goes over what needs to be done on their end of things, and brushing, of course, and then also using fluoride rinses to strengthen and decrease the sensitivity around the teeth afterwards. So that's something that needs to be done on the patient's end. On the other hand, since those pockets need time to heal, but they're also all those pockets are still prone to disease returning again, we'd like to see the patients back a little bit closer than 6 months. Every 3 months usually we'd like to see the patients back for what we call a periodontal maintenance. In plain English, it means that those pockets are still present, they're tightening up, they're healing, but there is still a chance that disease can return. So we're not quite to the point where there's no disease present, but we are to a point where we can prevent that disease from progressing. And so periodontal maintenance, which is done every 3 months, is done to try to prevent those pockets from returning. And at the same time, we do still want to see the patients on their regular cleanings to prevent further disease in other places in their mouth. So what really boils down to is every 3 months we see the patients for maintenance as well as preventive cleanings. So 4 times a year usually it's minimum after a deep cleaning is done.
And Dr. Adel, what can patients do to prevent to have a deep cleaning done again?
I kind of touched on that a little bit. Yeah, that's a good question that is asked. I know it's asked in a different way many times. Yeah, home care, very important. And really having the urgency to do the home care, and understanding that the disease, the worst case scenario is that if the prevention is not done on the patient's end, then the disease process can return, and it can return with a vengeance, to a point where then the bone can dissolve away very quickly, and sometimes then deep cleaning is not going to be the only option. Then we would have to do surgery, periodontal surgery, or gum and bone surgery, which is done by a periodontist or a specialist. Not only that is more time consuming and can be painful and also costly, it could be averted by better care and better follow-up with the patients. And of course, as professionals, we try to provide, like I said, 3-month follow-ups with patients to help them along, and also work on helping them improve on their oral hygiene as well as maintaining those pockets for them and helping them along.
Thank you, Dr. Adel, for answering all our questions.
My pleasure.